Hello everyone. This presentation is on Gui Pi Tang, also called Restore the Spleen Decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Gui Pi Tang is classified under Tonify. A representative pattern is spleen Qi and heart blood deficiency with palpitations, insomnia, poor memory, and easy bruising. Important ingredients include Ren Shen, Huang Qi, Bai Zhu, Fu Ling, Dang Gui, Long Yan Ru, Suan Zhao Ren, Mu Jiang, Yuan Zhai, Gan Kao, Shen Jiang, Da Zhao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 41-year-old woman with anxiety, fatigue and diabetes. The current medicines are metformin, warfarin, hydrochlorothiazide. This case gives a plausible reason to consider Gui Pi Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Dang Gui plus warfarin. The mechanism is Angelica sinensis may increase bleeding tendency with anticoagulants. The clinical significance is moderate because the patient is already anticoagulated. My management plan is monitor INR and bleeding. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Ren Shen plus metformin. The mechanism is ginseng may lower glucose. The clinical significance is moderate. My management plan is monitor glucose more frequently. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Gan Kao plus hydrochlorothiazide. The mechanism is licorice can lower potassium and raise blood pressure. The clinical significance is moderate with longer use. My management plan is monitor potassium and blood pressure. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Gui Pi Tang may be reasonable when the patient's presentation matches spleen Qi and heart blood deficiency with palpitations, insomnia, poor memory, and easy bruising. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.